Hi, I hope you're having a great day. Well, today I want to talk about something extremely important. When we look at the amount of cardiovascular deaths through heart attacks and cardiac arrests that happen all over the world, what we need to understand, there is a simple lifestyle change that we can all be aware of, that we can teach ourselves, teach our parents, teach our grandparents, and everyone should know this one simple method of breathing. So what happened is I've been in Dubai and Ajman over the last couple of days, spending a lot of time with doctors in hospitals and at charity hospitals, and we got talking about lifestyle disease. And what we noticed is that there are so many patients who have cardiac arrests, and they could have changed the outcome of that by just changing their breathing technique. So with these doctors over the last couple of days, I've learned this technique that I want to share with you. It's always existed, and basically we need to give credit to the Chinese for coming up with this breathing exercise, which is based on very simple science. So learn this and teach it to everyone around you, because it could literally save your life. Now, when we have a cardiac arrest, when we have a heart attack, what we need to understand that the heart is a muscle, and if the heart doesn't get sufficient blood carries nutrients and oxygen to your heart muscle. If the muscle doesn't get sufficient oxygen through your blood, it starts to die. And that's when we have a heart attack, a cardiac arrest. It could lead to severe damage of the heart, and of course it can lead to death at the same time. For that matter, any organ in the human body, if the brain fails to get oxygen, so for example, when we're drowning, we're underwater, or when we're suffocating, or we're being choked and there's less oxygen that reaches the brain starts to die, because we need blood circulation all the time, which is why we keep telling people exercise. It doesn't matter how rich you are, what your status is in society, but if you do not exercise, you basically create a body which is going to get sick, because it's devoid of blood circulation, oxygen, and nutrients. So coming down to this simple technique, now what we need to understand, when I teach you this technique, in most cases it should work. It doesn't always have to work, and it doesn't mean that you don't go to the hospital. So this is great for people who understand that they're getting a cardiac arrest. So sometimes cardiac arrests are silent. You don't even get a single symptom from the body. Some people have anxiety and sweating. Some people have high blood pressure. Some people have shortness of breath. Some people have palpitations. Some people have the pain radiating from their arm right up to their jaw. So you could be driving, you could be at home without any help, or in a sad situation, which happens in most crowded cities, you could be in the ambulance on the way to the hospital having a heart attack, and you could be stuck in traffic. So this is the simple breathing exercise that I'm going to teach you right now. First, let's understand the science, because when we understand logic and science, it registers in our subconscious mind and we end up doing it. So through this breathing exercise, what we're trying to do is basically cause constriction. We're trying to push oxygen into the lungs, and through constriction of the breathing method, we're trying to squeeze the heart to pump more circulation. So with this breathing exercise, we're trying to rush blood to your heart. Okay, the very thing that's not happening, and that's why you're getting a heart attack, basically. So if we can rush blood, oxygen-rich blood to your heart, we improve the oxygen saturation level in your blood, the SpO2 in your blood, and that can literally save your life in most cases. So the breathing technique is very simple. Okay, when we inhale, the ha sound. Okay, try making the ha sound, but you inhale with your mouth open. So I'm going to do a... Now you can sit with your back straight, you can be in a crouched position, you can be in a side position, or you can even be slouched like that. So you're trying to take in a lot of oxygen through your mouth. And then the way you exhale it is like a cough. So we're going to use a ku sound, like a Ku. So it's like a ku. So you do a ku, 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 ku. So now if you don't want to do the ku sound, you can even cough, because sometimes when you're having a cardiac arrest, if you try to forcefully cough, you're creating the same constriction. But it's very important that you inhale deeply before the cough. So now I can do a deep inhale and I can do a but I shouldn't forget to breathe, which is why I like the first method better, because when we start forcibly coughing, we forget to take the deep inhale. And remember, we're trying to get oxygen-rich blood circulation happening. So if I don't get the right inhale, I'm not getting the right amount of oxygen. So the ha-ku method is the best. It is the most effective. Practice it a couple of times so it gets registered in your subconscious. So when you are going through a heart attack, which I hope you don't, or if anyone's in that unfortunate situation of going through a heart attack, you remember the ha-ku method. So the ha is the inhale, where you inhale through your mouth. So it's And the ku is the exhale, a forceful ku sound. So now you may try it. It's like a ku. So you do it with force and you'll feel the constrictions happening, but this can save your life. I'm not saying it will save your life. I hope it does. Of course, you need medical attention. You should be on your way to the hospital. But even if you're driving, you want to stop, pull aside, okay, and you want to get into this breathing technique after you've called medical emergency to come and get you to the hospital. But remember, the human body is designed to protect us. It has inbuilt mechanisms to protect us. So when we're panicking, and panic is usually the biggest problem is panic, because we forget to do the simple things like breathing. So a lot of people say, I'm out of breath, I can't breathe. That's because they're forgetting to exhale. If you're a little calm at that point, all you need to do is exhale, because the very fact that you're breathing, there has to be an exhale, but you're panicking so much that you don't do the exhale. So it's the Ha-Ku method. I'm going to post that in the notes in this thread. Teach everyone this method, your parents, if you volunteer at old age homes, wherever you are, because the Ha-Ku method is not a replacement for your paramedics or your medical services, but it is something that can save your life. And these are things that doctors are teaching their parents across the world, and it's about time that all of us know this, because we never know when there may be a heart attack in our lives or in the lives of our loved ones. So I'm going to repeat that once more, because I wanted to get into your subconscious mind. It's the Ha-Ku method. So the ha is the inhale through your mouth. So it's like a, okay, but you do the ha and you do the ku. You do the ha, you do the ku. And it's like the ku, 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 ku. When you do the ku, you find that your body constricts. You find there's a little bit of force, and that's beautiful, because we want the heart, we want the lungs to constrict, to push more oxygen through your blood to circulate through your heart. And this is something that can possibly save you. Have a great day, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.